Hello friends, I am Lashmi. Welcome to SRS Info. Today we will continue with vitamins under the subject Health Education and Community Pharmacy. We have already completed the fat soluble vitamins and we covered up to vitamin B3 in water soluble vitamins. Today we will discuss about vitamin B6, that is pyridoxine. Pyridoxine, that is vitamin B6, is an essential nutrient for our body, and chemically this is a group of 6 compounds, chemically similar compounds. We can simply call it as 6 vitamins. What are they? They are pyridoxine, pyridoxal, pyridoxamine, pyridoxine 5-phosphate, pyridoxal 5-phosphate, and pyridoxamine 5-phosphate. These are the 6 chemically similar compounds which makes the vitamin B6 altogether. Okay, and the most active form of this compound is pyridoxal 5-phosphate. This one, highest biological activity, and this functions as the coenzyme in more than 140 enzyme reactions in our body. Okay, so this is that much active, this compound. It functions as the coenzyme in more than 140 enzyme reactions in amino acid, glucose, and lipid metabolism. So that much important is this pyridoxal 5-phosphate. And it also protects plants from ultraviolet B radiation of sunlight, participates in chlorophyll synthesis. So this active form is very important. And this pyridoxine cannot be synthesized by animals. Maximum vitamins we have to take by diet. It's not possible to synthesize vitamins in our body. So we have to take it by diet. But some quantity, very minimal quantity, is produced by intestinal bacteria. The healthy bacteria, the bacteria which are essential for our body. This intestinal bacteria can produce small amount of this vitamin B6. And vitamin B6 is a water-soluble vitamin. And the most stable form of this vitamin is pyridoxine hydrochloride. Clear? This is the most stable form. And the most active form we have already seen. What is it? That is pyridoxal 5-phosphate. And the commercial synthesis of pyridoxine is known as oxazole method. This is very, very important. Not the point. That is, oxazole method is the process by which we can produce vitamin B6 commercially. And the pyridoxal 5-phosphate, which is most active form, is also involved. This is involved in macronutrient metabolism, neurotransmitter synthesis, histamine synthesis, hemoglobin synthesis and function, gene expression, coenzyme in carboxylation, transamination, racemization, elimination, replacement, etc. These all are the functions. These are the reactions taking place within our body. What do you mean by racemization? The transition from an active form to an inactive form, we can simply call it as racemization. Clear? So these are the main functions where the pyridoxal 5-phosphate plays an important role. And this is also involved in the biosynthesis of important neurotransmitters. What are the most important neurotransmitters within our body? These are serotonin. You have already known about these things, okay? You may know about it. Serotonin, epinephrine, dopamine, norepinephrine. All these are important neurotransmitters. Biosynthesis of these neurotransmitters is controlled by pyridoxal 5-phosphate. And is also the coenzyme of glycogen phosphorylase enzyme, which is necessary for glycogenolysis. The breakdown of glycogen is known as glycogenolysis. Okay, and during this glycogenolysis, we need an enzyme, that is glycogen phosphorylase. And this pyridoxal phosphate function as a coenzyme of this glycogen phosphorylase. And this aids in the synthesis of hemoglobin and decarboxylation of carbohydrate. All these are the most important functions of vitamin B6, we can call it as, and especially the most active form, that is pyridoxal 5-phosphate, plays important role in all these activities. Then what are the medical use of vitamin B6? This is mainly used to reduce the side effects of isoniazid. What is isoniazid? Isoniazid is the medicines which is used in the treatment of tuberculosis, TB. This is one of the medicine which is used for the treatment of TB, and to control or minimize the side effect of this isoniazid, we can use vitamin B6. So during this tuberculosis therapy, along with the medicaments which are used to treat this disease, the pyridoxine is also given. So vitamin B6 is that much important. So it's very important to know what are the resources from where we have to get this vitamin B6. Milk, liver, meat, egg yolk, fish, whole gram cereals, legumes and vegetables. These are the most important sources of vitamin B6. So we have to make a daily routine of taking these vegetables and these food items to get the pyridoxine, for pyridoxine in sufficient amount. But what is the requirement, daily requirement? The most important thing is for adults, that is normal people, we need 2 milligram per day. But during pregnancy and lactation, the requirement is little high, that is 2.5 milligram per day. Okay, so to get this 2 milligram per day, we have to manage our diet by including those items which are rich of pyridoxine, like milk, egg yolk, vegetables, legumes, cereals, etc. Okay, and if you don't take that much sufficient amount of this pyridoxine, then what may happen? This may lead to deficiency of pyridoxine. Both in adult and children, the symptoms and diseases are different due to the deficiency. In children, irritability, abdominal distension, loss of body weight, anemia, these are the most important deficiency syndromes of pyridoxine. But in the case of adult, the lesions of skin and mouth, peripheral neuritis, mental changes are the most important deficiency diseases in adult. What do you mean by peripheral neuritis? We can simply call it as the numbness or the pain of nerves due to exposure to toxins or some damages. There may be a numbness or pain in the nerves, that is called as peripheral neuritis. So these are the deficiency diseases in adults, and these are the deficiency diseases in children due to the deficiency of pyridoxine or vitamin B6. So these are the important points related to vitamin B6 which are important for your exam. Hope you enjoy this video. Thank you.